According to the OECD, low health literacy rates can lead to an increase in hospitalizations, greater use of emergency care, as well as lower adoption of preventative measures. Therefore, we call on G7 leaders to ensure accessible, equitable, and high-quality health literacy education for young people, especially those in marginalized groups, through its inclusion in school programs both domestically and globally.
We recognize young people's desires to have accessible and affordable health services for all. This is compounded by the necessity of distributing the COVID-19 vaccine both within and without the G7. Therefore, we call on G7 leaders to increase public health care spending by 1% of GDP across the G7 to reinforce universal health coverage in countries that offer it, and move closer to a universal health system in countries that do not. We also demand that the G7 strive to make COVID-19 vaccines available to all before the end of 2021, especially through assistance to countries outside of the G7, through investments in partnerships such as COVAX or ACT-A, or through new partnerships as necessary.
There are still so many disparities when it comes to healthcare access, especially for marginalized populations. And so we're calling on G7 leaders to take definitive action to tackle them by implementing better community healthcare and social care programs, as well as by upholding higher anti-discrimination accountability standards in healthcare environments.
From March 2020 onwards, anxiety and depression increased and in some countries even doubled. The COVID-19 crisis has led into a mental health care crisis for young people, and still it is nowhere on the G7 priority list. Therefore, we want G7 leaders to provide universal, accessible and affordable mental health care services, first, as a part of primary care provision, and second, in convenient environments such as educational and workplace settings where youth may seek help, in order to offer help when and where it's needed.
The common societal attitude towards young people is to act upon them without their agreement. The political agenda often focuses on youth shortcomings and problems rather than investing in youth potential as a positive source of change. And this is valid, this is true also with regards to the development of mental health services. For this reason, we want G7 leaders to include youth directly in designing, delivering, promoting and evaluating mental health services intended for them.
Half of mental health conditions start by age of 14, but most cases still remain undetected and untreated. Mental health is still accompanied by stigma and shame. Therefore, we ask on G7 leaders to immediately introduce curricular changes and train young people to be able to adequately support their peers in need, in order to finally eradicate all stigma around mental health.
We call for G7 leaders to provide and implement cyber education for all medical professionals. We need our cyberspaces to be safe, regulated and reliable, and healthcare needs to be protected properly with proper monitoring systems. There needs to be a huge emphasis on patient information privacy. Millions of records are leaked annually, and not much is being done about it. We are losing billions of pounds because we are not being safe enough. And once our private data gets out, it can never come back.
We want G7 leaders to permit a secured interoperability for health data collected, especially in health research. Across 37 countries, only 12% of all policy initiatives aim to increase data analytic capabilities in either the public or private sectors. Therefore, by this recommendation, we aim a better pandemic responsiveness and an equitable sharing of findings between all stakeholders and countries in a secured framework with robust privacy guarantees.
Every G7 country needs a plan on how their digital healthcare services are being implemented. Therefore, we call for the G7 leaders to increase the digitalization of healthcare services, to empower patients and patient care, to use better novel technologies and use interdisciplinary collaboration. We believe that every G7 country should use WHO SMART guidelines in their digitalization of healthcare services.